Have you ever wondered how a doctor figures out what's wrong with a patient who can't even talk yet? Well, today we're going to step right into a pediatric exam room. We'll see exactly how clinicians read the subtle, silent language of a child's movements to spot potential developmental delays. It's like being a detective, so let's follow the clues and see how a medical puzzle gets solved without a single spoken word.
And right away, you hit the central challenge. The child in this case study, well, he's anxious, he's in a strange place, and he is not ready for an exam. So before any medical assessment can even start, the first hurdle isn't medical at all, it's human. How do you build trust with a child who is scared?
The answer, it turns out, doesn't start with a stethoscope or a reflex hammer. It starts with something much simpler. Because the first step in any good diagnosis is just making a connection. Now, this might look almost too simple, but it's actually a brilliant clinical strategy. Instead of forcing the situation, the trainee offers a toy, handing over a little bit of control. By just waiting for the child to get comfortable on his mother's lap, she's doing more than just being patient. She's turning a scary, sterile room into a safe space.
You know, as the supervising professor points out, this one small act completely changes the dynamic. The child is calm, he's engaged, he's ready. It's just a powerful reminder that in pediatrics, building rapport isn't just a nice thing to do, it's the foundation of the entire diagnosis.
Okay, so with that trust established, the real observation can begin. And now the trainee isn't just looking at the child, she's searching for tiny, specific clues in every little movement, kind of like a detective piecing together a really complex puzzle.
The very first clue she looks for is head control. I mean, think about it. It's the foundation for almost every other movement. She watches closely, and the verdict is good. That's a huge first check mark, and it gives her a baseline of what's developing normally.
Next up, she watches him turn over. And, yup, another milestone achieved. But here's the thing. This isn't just a simple action. Being able to roll over means something really important has happened on a neurological level. It means a specific, primitive reflex has finally disappeared.
So what is this invisible barrier? What is this reflex that has to vanish before a child can gain the freedom to roll from their back to their tummy?
It's called the asymmetrical tonic neck reflex, or ATNR for short. You can actually think of it as an automatic fencing pose. When a baby with this reflex turns their head to the side, the arm on that side just instinctively straightens out, which physically blocks them from rolling over. The fact that this child can roll tells the doctor that this old, primitive wiring has faded away just like it's supposed to. That's a huge step forward.
All right, so after the big body movements, the focus shifts to something much smaller, much more precise. The trainee offers the child a tiny pearl to see if he can use a pincer grasp. You know, that little thumb and forefinger pinch. This isn't just another clue, it's a completely different type of clue, testing the delicate wiring of his fine motor skills.
So, let's take stock. We've got these individual clues, head control is good, he can roll over, and he's trying to use a pincer grasp. But you know, in medicine, clues in isolation don't mean a whole lot. The real art is in stepping back and seeing the pattern that they're all forming together.
And this is the breakthrough moment. This is where it all clicks. The developmental delay isn't across the board. It's not affecting everything. His intellect seems perfectly fine, and those small, fine motor skills are more or less on track. The problem is very specific. It's with the big movements, his gross motor skills. This isn't just a clue anymore. It's a giant arrow pointing the team in a very specific direction.
Seeing this specific pattern is the key that unlocks everything else. It lets the clinical team stop casting a wide net and start asking really precise questions to hunt down the root cause of the problem.
So the first question is a big one. Is the problem in the control center, the brain, or is it somewhere in the machinery of the body? Since his intellectual functions appear to be fine, a problem in the brain itself is pretty unlikely. That means the issue is probably peripheral, somewhere out in the network of nerves and muscles that are supposed to carry out the brain's commands.
Now they can narrow it down even further. So, is it the wiring that carries the signals, the nerves, or is it the motors that perform the action, the muscles? Based on the specific kind of weakness they're seeing, the team starts to suspect a muscle problem is the most likely culprit.
But even muscle problem is still a bit broad. It could be a condition like myopathy, or it could be something more serious like muscular dystrophy. And here's where a simple blood test becomes the key differentiator. They test for an enzyme called CPK. In muscular dystrophy, the CPK levels are way higher, giving the team a really clear biochemical signpost to follow.
So all of that careful watching has led to this, a concrete, logical plan of action. They're going to run tests to study the nerve and muscle functions, measure those key enzyme levels, and maybe even do a muscle biopsy down the line. It's just a perfect illustration of how patient observation leads directly to a targeted scientific investigation.
What started with a simple toy and a moment of connection ends with a precise medical plan. It's an amazing reminder that even in our world of high-tech scans and machines, sometimes the most powerful diagnostic tool we have is just a curious mind and a trained pair of eyes. Kind of makes you wonder, right? In our own lives, how many important details do we miss simply because we don't take the time to stop, connect, and just watch?